As the House and Senate start figuring out what the final version of health care reform should look like, they've got to tackle a big question. It's $500 billion question. In fact, the president has said that he can free up hundreds of billions of dollars for health care reform if you eliminate the waste and the fraud in Medicare. That figure, again, $500 billion. How do you do this? Florida Congresswoman Ginny Brown-Waite is a Republican and member of the House Ways and Means Committee. You represent a district of Florida that has a number of America's finest seniors, the Villages, one of the largest senior areas, I think, frankly, in America. So welcome to our program here. How do you cut $500 billion out of Medicare?
Well, as the member of Congress with the most number of people on Social Security, that's a very important question for my constituents. I have about 250,000 people in my district on Medicare. So obviously what we want to do is come up with a way to make some meaningful cuts. And you know, the best way to do it is to tackle the really difficult issue that trial lawyers don't like, and that is doing something important on some kind of meaningful tort reform. And that alone would produce a substantial amount, about $16 billion, it's estimated, and actually more than that when you take into consideration that it would end a lot of the defensive medicine that so many physicians and hospitals have to practice today.
We talked a lot about that on this program, and the CPO confirmed exactly what you're saying. You can save tens of billions of dollars if you enact a meaningful version of tort reform. But back to the issue of waste and fraud, I think we can all admit there is waste and fraud in this system. There's probably waste and fraud that you can find in every system. Is there $500 billion worth of waste and fraud?
You know, it's interesting because the Medicare HMOs, the Advantage plans, they are much better at detecting waste and fraud and abuse than traditional fee-for-service Medicare. So they have much better alert systems than traditional Medicare, than CMS has. So there certainly are ways to detect it and go after it. We do need to make sure that every dollar that is wasted in fraud and waste in the system, that we go after those dollars. And today, this week, I'm going to try to get my colleagues to agree that any savings in Medicare have to go back into the Medicare system. You know, every day, 22,000 more people are applying for Social Security and Medicare. So we need to make sure that we shore up Medicare, go after every single dollar of waste.
I think you make a great point on all that, but if you're going to take $500 billion out of one program, how can you do that and not hurt seniors? Do you believe that?
Well, that's my point exactly. It is going to hurt seniors. If you're on a Medicare Advantage plan, despite what the president says, you're going to have an increased cost. You're going to be paying more for Medicare if Medicare Advantage is starved out of existence by as the Senate bill does.
Now, Medicare Advantage has its share of critics, too, as you well know. And there's nothing in the system that is perfect. But if I could just drive to this one point. Yesterday I was listening to the press conferences on the Democratic side and the Republican side after this vote was made in Senate Finance Committee. And some of the Republican senators have said a couple years ago they tried to cut about $80 billion. I think that was roughly the figure out of Medicare. And they were shut down by the Democratic side. Now, is that the case? And if that is true, I mean, who's sitting here thinking that $500 billion can be sliced out now? Who's going to agree to that?
I don't think it's realistic that you can slash $500 billion. It's not real, but it's a figure that's being used to pass the bill, and then how they'll make up that difference is clearly what they'll be doing is raising even more taxes, which my Democrat colleagues are so good at doing.
Ginny Brown-Waite, thank you for your time today. We're trying to get to the bottom of it. $500 billion is nothing to sneeze at. Well, I guess in this economy, when we're talking about trillions and trillions, you know, $500 billion seems like we're saving money. Ginny Brown-Waite, thank you for your time today from the Hill, and we'll watch it as it proceeds. Thank you.